About 745,000 residents, 1 in 10 of the population, suffer from diabetes, according to the International Diabetes Federation. Although many health experts believe the numbers are higher. The UAE is ranked among the top 10 countries with a high prevalence of diabetes, and according to health experts, both diabetes and obesity represent a new health challenge to the UAE. It is for these reasons centres such as the Rashid Centre for Diabetes and Research in Ajman have been set up. The centre is owned by the UAE Ministry of Health, but managed by Global Health Partner, a Swedish healthcare organisation which has extensive experience in developing and promoting specialised healthcare services across the globe. According to the CEO of the Rashid Centre for Diabetes and Research, Bengt Ternstrom, improving the health of patients diagnosed with this disease is dependent on a number of factors, but most importantly, it's to start treatment early. Firstly, thank you very much for your time today.
My pleasure. Good to have you here.
Now, the Rashid Centre for Diabetes and Research was established in 2010 by the UAE Ministry of Health as the National Reference Centre for Diabetes and Obesity Treatment and Research. Can you tell us what are the main responsibilities of this centre and how are you fulfilling these responsibilities?
First, the setup of this centre was based on an initiative from the Ministry of Health, as you said. And the result of that, I think, was that the government in the UAE found that the prevalence of diabetes is too high. And they wanted to establish a third level of diabetes care, where the first and second level was done by the primary health care and the hospitals. We are here to provide specialist treatment of patients who have complications or will develop complications from their diabetes or from their obesity. So in that sense, we are giving the society a third level of treatment that they cannot get from the first and second level. We believe that we make a difference because we have in-house all the specialities needed for treatment of complications of diabetes and obesity.
Now, the centre is unique in that it is owned by the UAE Ministry of Health, but it is managed by Global Health Partner in collaboration with the Swedish public Skåne University Hospital and Lund University. In your opinion, how has this collaboration further enhanced the services provided by the RCDR?
Global Health Partner is a Swedish company who are specialized in running and managing specialist clinics. We strongly believe that quality can be ensured only through being specialized. And being extremely specialized, the more procedure you do of the same type, probably the better you're going to be on those procedures. Now, to ensure the quality, we believe that we should have a third party who can monitor what we are doing. And in Sweden, there are a number of university hospitals that can provide that quality insurance. For example, Skåne Hospital and Lund Hospital. And through the collaboration that we have with them, we have been able to, already after only 3 years of operation here, reach clinical results that are comparable with the organization that have been in the business for decades. And by having that third party of quality assurance, we have probably added value to the care of diabetic patients in the country.
Let's look at diabetes now. How prevalent is this disease in the UAE?
This is a very difficult question to give a straight answer to. It is probably much higher than published. There hasn't been a lot of surveys done in the past. The latest one is a few years back, but we are missing in the country some kind of diabetes register, some kind of guidelines on how to screen patients. However, published figures shows around 20% prevalence of diabetes, typically on primarily type 2 diabetics. But we believe that the hidden figure, the pre-diabetic patients, are maybe as high as 30% to that figure. So it is, in an international perspective, a very high figure. If you look at the Gulf countries, it's still like in the Gulf countries, 20% seems to be an average, whereas if you go internationally, that's a very high figure.
And what is that figure overseas?
You could expect maybe if you look at Northern Europe, somewhere around 4 or 5%, in that neighborhood at least.
From your research and experience, why do you think there is such a high prevalence of this disease in the country in comparison to other countries?
Again, a difficult question to give a straight and scientific answer to. Research are done. Some indications are given that it could be a genetic reason for it, however not scientifically validated. I would say also that the genetic part could maybe a lifestyle part, where people in this part of the world live in a certain way, they eat in a certain way, their lifestyle, their exercise, their physical movement is different. Exposure to environment might also be adding to it. We don't really know why it is so high here, but very typically the Gulf countries have high figures.
Now tell us about the treatments available for those who suffer from diabetes, and more importantly, how can patients control and cure this disease?
Diabetes is a chronic disease in the first place, so once you get it, you have it for life. Most patients, also in UAE, are able to control their diabetes, and they can live a perfectly normal life until they grow very old. The challenges that we have in the country is to encourage our patients to self-monitoring and self-management of their disease by changing lifestyle, for example, by being compliant to care plans. In our center, we are providing them with a multidisciplinary care, which means that they are monitored, they are checked, they are controlled in regular meetings, episodes. We see them typically every third month until we can see that they are compliant to our care and until we can see that they are controlling their own diabetes. For some patients that goes fast, some patients need longer time for it. You also have an element of being comfortable with your disease. When you're diagnosed initially, I think you're in a shock. But once you have learned to live with the disease, you feel that I'm not so bad, and after some time you feel that you are controlling it. But that is the first warning sign, because that means that you're not actually looking to the body warning signs, saying that you might develop complications. So this is what our challenges every day. The majority of our patients are controlling their own diabetes.
Welcome back. The Rashid Centre for Diabetes and Research also has a number of initiatives set up focusing on the obesity epidemic in the UAE. And bariatric surgery is one of the treatments offered at the centre for both diabetics and obese patients. But how successful is this surgical procedure, and how many patients choose to undergo this surgery? We continue speaking with the CEO of the Rashid Centre for Diabetes and Research, Bengt Ternstrom. Now, the RCDR also has a number of initiatives directly focusing on the obesity epidemic in the country, and the statistics really are alarming. 30% of children in the country are obese. This number increases in adults, with 70% of women and 60% of men currently overweight in the country. In your opinion, are we seeing any progress made in decreasing these figures?
Slowly. It is. If you look at it internationally, you can see the same trend. Kids today are living a different life from kids 100 years ago. You can see that the mobility of people are higher than before. People are picked up by the school bus, taken directly to school. There is no physical training maybe in the curriculum in the school. They come home after school, go directly into their TV games and sitting there. In addition to that, maybe eating food that is not suitable if you are an obese person. So I think we must accept that it will take time to see changes. We also have to accept that it takes time to change the logistic as well. With that I mean we need to create in the cities like a jogging path, bicycle path, parks, amusement areas where people can actually, as a natural part of their life, exercise and change their lifestyle. So I cannot say that we can see any tangible changes, but the time is too short for that.
Now, bariatric surgery is one of the treatments available for both obese and diabetic patients. Can you tell us a little about this surgical procedure? How successful is it, and how many patients opt for this procedure?
We offer our patients surgeries as a part of the diabetes treatment. The whole process is to have the patient to understand that the surgery itself is not the ultimate solution to the treatment and their disease. They first have to add on themselves to the treatment, which means that we do a pre-surgery recruitment, you could say, of patient, where we actually require the patient and having a commitment from the patient to reduce their weight in a natural way by changing lifestyle, eating habits, etc., etc. Once we have decided to go for a surgery, again, the patient has to be committed to change life after the surgery. We do around 100 patients, and we can see on all our patients that they present a substantial weight reduction already after 6 months after the surgery. And reducing the weight is important for a diabetic patient. And typically we can see that they lose like 50, 60, 70% of their overweight in 6 months. The good thing with this is that we can also reduce the medicine. Typically a patient reduces his need of medication down to 10% already after 3 to 6 months. Some of them are not even on insulin after this surgery. So it is a very successful treatment. And we can see if we compare with the university hospitals in Sweden that on longer term, like 10, 15 years, the majority of those patients will not gain weight afterwards. So if you think you can cure diabetes, bariatric surgery is maybe the only solution for it.
Finally, what's next for the centre? What are some of the initiatives you plan to reveal in the coming months in a bid to combat diabetes and obesity in the UAE?
It is internationally known and scientifically proven that the earlier you can start treat the disease, the better outcome you will have. So what we have done now and what we will do now is to transfer part of our knowledge in diabetes to the primary health care. We have started up training programs for diabetes nurse educators, dietitians, and also general physicians in the primary health care, where we will ensure that they give the first right diagnosis of the patient. We have started that as a pilot project, and we hope and believe that we can run it as a national program after the end of this year. Secondly, unfortunately, we have also seen that the entrance to the disease goes down in age, starts earlier. So we will start a pediatric clinic here as well, where we can treat children and also antenatal babies, unborn babies, to treat the mothers before they deliver the baby.
Bengt Ternstrom, thank you very much for your time today.
My pleasure. Thanks a lot.